Hello, everyone, and welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. You will learn today about a multi-year international study that assessed the transportability of a violence prevention parenting program in 3 diverse contexts: the chronic conflict zone of Gaza and the West Bank, Ishinomaki, Japan, a region recovering from a natural disaster, and a remote and underserved region of Indonesia characterized by deep poverty and illiteracy. In all 3 places, parents experience chronic and severe stress, and physical punishment is widespread and remains legal. The study's author, Dr. Ashley Stewart Tefescu, will discuss the findings related to developing, adapting, implementing, and evaluating the Positive Discipline in Everyday Parenting program, as well as the lessons learned. Right now, I have everyone on mute, to avoid background noise. We welcome you to ask any questions or comments that you have in the questions box throughout the presentation. The presenter will answer any questions at the end as time permits. Dr. Ashley Stewart Tefescu is a registered social worker and a research fellow in the departments of Community Health Sciences and Psychiatry at the University of Manitoba in Canada. She currently holds the Children's Hospital Research Institute of Manitoba Postdoctoral Health Research Fellowship. Ashley's research focuses on global child protection, adverse childhood experiences, and implementation science. Her research involves the implementation of child maltreatment prevention and intervention strategies in diverse cultural and religious settings. Her program of research spans 19 different countries throughout Asia, Latin America, the Middle East, and Southeast Asia, including many underserved regions. Ashley, we thank you so much for being with us today and sharing your insights on this important study. Now I will turn it over to you. Give me one moment. Okay, great.
Great. Are you able to hear me?
Yes.
Great. And are you able to see the slides?
Yes, it looks good.
Fantastic. Well, welcome everyone. I'm absolutely honored to be presenting at a webinar today. This is the first sort of formal webinar that I've had the chance to do, so I'm really excited. So before I begin, I'd really like to thank IPSCAN and Heather for this opportunity. It's really unique to be able to share my research in a way and to the members of IPSCAN and to reach such a diverse audience today. So without further ado, I shall begin. As Heather said, I'm presenting a research project that actually was a part of my doctoral research that spanned many years, and it was really focused on assessing the transportability of a violence prevention parenting program to 3 diverse country contexts. And so today I thought it would be useful to maybe many of you who are doing similar work to maybe learn some of the lessons and also some of the challenges that we experienced, or that I experienced doing this type of research. So just to give you an overview of the presentation, for the next 45 minutes, I'm going to begin by sort of situating the issue of punitive violence against children in the global context. I'm going to briefly review the literature on parenting programs and parenting programs specifically designed to prevent violence against children in diverse settings. I'm then going to narrow my focus on the particular program that I examined, which is called Positive Discipline in Everyday Parenting. This is a program that was designed by Dr. Joan Durant, a clinical child psychologist from the University of Manitoba. Then I'm going to spend quite a bit of time, the majority of my presentation, describing a particular framework that I use to systematically evaluate the processes involved in transporting a parenting program to 3 diverse contexts. And then I'm going to be presenting some general findings and some impact evaluation, and then finally concluding the presentation by sharing some of those lessons that we learned from developing, adapting, implementing, and evaluating a violence prevention parenting program. So to situate punitive violence in the global context, the world over, the most pervasive form of violence against children most often occurs in the confines of the family home and in institutions where children live, and this is often done to children by parents and other caregivers. And it's estimated that nearly 1 billion children worldwide are hit, slapped, spanked, pinched, belittled, humiliated, or otherwise physically and emotionally punished on a regular basis by their parents, caregivers, or other trusted adults. And these forms of punitive violence against children are often, defended as a parental right, or justified as necessary for child rearing, or even justified as cultural or traditional child rearing practices. And we know that this is very concerning because, there's quite a large body of research that's accumulated over a number of decades now, including some meta-analyses, that's studied the outcomes associated with punitive violence in various populations in different countries, using different measures, and the results have consistently found that punitive violence is associated with only negative outcomes in childhood and also in adulthood. And no rigorous scientific evidence has ever found punitive violence to be a benefit to children's development and learning and overall health and well-being. So you can see here that there are 10 negative outcomes in childhood and 4 negative outcomes or risk of detrimental outcomes in adulthood. And not only are these detrimental outcomes concerning, we also know that punitive violence is a human rights violation. The United Nations Committee on the Rights of the Child has indeed proclaimed that punitive violence is a human rights violation. This is clearly described in General Comment number 8 in relation to Article 19, which states that children have a right to be protected from all forms of violence, and this does include corporal punishment. A number of countries to date have taken the initiative to legally prohibit all forms of punitive violence against children, and this includes violence in the home. And in addition to law reform and advocacy and awareness raising campaigns to end punitive violence against children, there have been calls for parent education and support programs to really target parents' behavior. So with that in mind, I wanted to look at the literature to see what exists in terms of supporting parents through parent education and promoting their behavior change. And when I looked at the literature, generally speaking, the literature examining the effectiveness of parent programs and specifically violence prevention parenting programs is rather limited. What I found is that the majority of existing parenting programs have really been developed or conceptualized and also evaluated in high-income countries and Western contexts. And the evidence of the effectiveness of transporting these programs to other settings is very limited, and what does exist is rather inconsistent. As well, I noted in the literature that punitive violence is especially pervasive in regions that are characterized by war or conflict, natural disasters, poverty, being under-resourced, having low levels of access to education. And it's theorized that stress overwhelms parents' attempts to survive in these types of situations. And so it's theorized or hypothesized that these regions are often overlooked by researchers due to the significant challenges of working in these extreme contexts, of course. And there's also this underlying assumption that change is unlikely in these situations given the magnitude of stress and other challenges that parents may face just to ensure daily survival. I also noted in the literature that very little literature has actually evaluated or documented what it takes to actually transport programs to these diverse contexts. And there's very little information that describes what it takes to take a program to a low and middle income country or a developing country. So there's this great unknown around what are the processes involved in transporting a nonviolent parenting program. As well, very few studies have examined the utility and necessity of cultural specific adaptations of parenting programs. And again, the few that have reported mixed results, suggesting that yes, indeed, you should culturally contextualize the program in order to increase the program's relevance, and others suggest that it's unnecessary to do so. And the literature also found that evaluation outcomes, so those impact evaluations, the ones that you typically do see in the literature, are challenging to interpret if the adaptation processes, the mechanisms of implementation, and the contextual factors are not necessarily considered and not documented or published in the literature. So taken together, the purpose of my research was to really address some of these gaps in the literature. So first, I wanted to systematically document and analyze those processes involved in transporting a violence prevention parenting program to three very diverse contexts, those that are often overlooked in the literature. And the first, as Heather mentioned in the introduction, is Gaza and the West Bank, including East Jerusalem, so generally speaking, a Palestinian conflict zone. The second was Ishinomaki in the Sendai region of Japan, which is a region that was hit by a large tsunami. I'll be talking a little bit more about that in the specific case study, but this is a Japanese disaster zone. And the third is looking at implementation. What are the processes involved in implementing a program in a rather remote and underserved region in Indonesia? And then the second purpose of my research was really to then evaluate what are the preliminary outcomes. So I was looking at relevance, effectiveness, and impact when you actually transport a program to these three diverse contexts. So I really wanted to connect not only the outcomes, but also look at the processes to help understand the outcomes. So as I mentioned earlier, the program that I chose to examine is Positive Discipline in Everyday Parenting, and you may be familiar with this program. As I mentioned, it's a program that was developed by Dr. Joan Durant about 10 years ago. And what's particularly unique about this program, PDEP, is that it's a rights-informed violence prevention parenting program. So the primary target or outcome of this parenting program is not to increase child compliance, but it's to reduce parents' use of punitive violence in challenging situations with children. The program is also unique in that it takes really a continuum perspective, so it targets families of children from birth all the way up to 18 years of age. The program is designed to be not-profit and accessible for all parents and caregivers, regardless of financial resources. And the program was designed in partnership with Save the Children. Many of you may know it's an international non-governmental organization that really works to promote children's rights and provides support to children and families in 120 countries around the world. So when the program was developed about a decade ago, it was actually developed in Thailand and in Canada. So it wasn't just a program that was developed in the West, it was a partnership between Thailand and Canada. And then the program was reviewed extensively by parents and also youth and children in Fiji, Hong Kong, Japan, and Thailand. And so based on those review processes, those experiences, the program was revised and improved. And then the next step in the development of PDEP was development workshops with NGO staff from across Asia. And then finally, the program was piloted in Canada, Cambodia, Fiji, Korea, Mongolia, and Romania. So the program was, from the initial sort of outset, was designed to be universally relevant and culturally appropriate to families all over the world. And to date, you can see the map here, Positive Discipline in Everyday Parenting has now been implemented in more than 36 countries around the world. So just to say a little bit about the theoretical model of the program, the theoretical basis of PDEP is based on the theory of planned behavior change, which is really a social cognitive theory to explain how our cognition and our affect actually influences our behavior. And so this theory specifically focuses on three cognitive components. So there's behavioral beliefs, the top box there, normative beliefs, and lastly, control beliefs. And so according to the theory, beliefs about a particular behavior will lead to one either evaluating it as more positive or more negative. And the more positive our evaluation of a behavior is, the more likely it is that we're going to perform that behavior or act in a particular way. So in terms of parenting, the more positive attitudes that parents have towards punishment, for example, may mean that there are stronger intentions to use punishment in response to conflict with their child. So PDEP is really designed to target parents' beliefs about punishment, both physical and other emotional forms of punishment, with the aim of reducing the approval of it. So in the program, for example, the facilitator leads the parent through a number of these experiential exercises that are designed to reduce parents' approval of punishment by increasing their understanding of long-term developmental risks that are associated with punishment, so that research we just looked at, and also increasing their understanding of the long-term benefits of healthy parent-child relationships that are built on the notions of attachment and trust, communication, and mutual respect. The program also targets normative beliefs. So these are people's perceptions of what others expect of them. These beliefs contribute to perceived social pressure to engage in a particular behavior. So for example, a parent may perceive punishment as normative and perceive social pressure to punish their children. Normative beliefs are also related to parents' perceptions of typical child behavior. So those that believe, for example, that toddlers can sit still for an extended period of time may perceive social pressure to act when their toddler does not meet out that expectation. And so if they believe that punishment is normative, then they're more likely to respond to their child's behavior with punishment. So the program is aimed at transforming parents' normative beliefs specific to understanding children's typical behaviors and also parents' responses to typical parent-child conflict. And in terms of control beliefs, which is the last sort of belief system here, this is really about parents' beliefs that they can respond to their children without using physical or other humiliating forms of punishment. So it's the parent's perception of their ability to perform a particular behavior. So PDEP is really designed to strengthen parents, their belief systems that they can respond to parent-child conflict non-punitively, and they can respond constructively with positive discipline. So here you can see when we look at the program aims, if we're targeting behavioral beliefs, we're looking at decreasing approval of physical and emotional punishment. Subjective norms is about decreasing perceptions of children's typical behavior as intentional misbehavior. And control beliefs is increasing parents' sense of self-efficacy so that they believe that they are competent and confident to use positive discipline as opposed to using punitive violence to respond to parent-child conflict. So the methodology that we used, or that I used to guide this research, is something called the realist impact evaluation. And why I chose this is because it's sort of the crux of the methodology states that nothing works everywhere or for everyone, and that understanding context is essential to understanding program outcomes. So if we only look at outcomes, but we're not understanding the context and the mechanisms, it's difficult to interpret the program outcomes. So it was really this combination of context, mechanism, and how we can use that to interpret our outcomes. So I want to give credit to Dr. Gregory Ahrens from UC San Diego. He's a professor of psychiatry, and he's developed something called the Dynamic Adaptation Process framework. And this framework really was useful in my research because I was able to document what are all of the steps that I need to examine and consider when transporting a program to a diverse context prior to looking at impact evaluation and sustainability. So I'm going to briefly talk about this dynamic adaptation process model and show how I used it in my 3 studies. And I want to introduce this new term, scaling out. I'm not sure, if any of you are familiar with this term. Of course, many of us have heard about scaling up, but Ahrens has described this scaling out as an important component of, evaluating any sort of evidence-based intervention. So it's not about going wide and big, but it's really about taking a program that was, designed and implemented in one specific context, adapting it or tailoring it to a new healthcare delivery system or population to see if you're still getting the same intended outcomes. So it's this concept of scaling out. So here you can see on the screen is the DAP, or the Dynamic Adaptation Process. And like I said, it's a framework for really documenting and implementing or interpreting, these mechanisms of impact. So for the first research objective, which was really to understand process, there are 3 key phases that one must go through prior to transporting or throughout the transportation process. And the first is the exploration phase. And this involves really a comprehensive system level assessment, an organizational level assessment, really understanding the providers and the people that you're going to be working with that are going to be the local staff actually implementing the program, and finally, who's the end user? So what are the characteristics of the clients, the ones that you hope to benefit from this particular program? So prior to doing any sort of implementation, it's really key to spend quite a bit of time in this exploration phase, understanding the context in which you're working or hoping to work. The next step in the DAP framework is the preparation phase. So what do you need to do in order to prepare to transport the program to this new context? So here it's looking at the materials, the translation, assessment and review. What are things you need to do to contextualize and adapt, and training assessment? So what's the training going to look like? Is it going to look the same as it was in the previous context, or are you going to have to change your delivery format? The third phase is really looking at the implementation. So this is where you've taken the new program and you're going to implement it in the diverse context. So what's the training look like? What does the mentorship look like? And what are you going to do with the feedback from the facilitators and the organization feedback to improve the program prior to actually implementing it with the parents and then evaluating it? So the 4th stage of the DAP framework is really the sustainment phase. And here in my research, I was looking at what are the preliminary outcomes, looking at program relevance, effectiveness, and impact for parents, and looking at for the training model, what's the training program relevance, effectiveness, and impact for program facilitators. So I'm going to take a breath here and take a sip of water. The first context that I set to look at was transporting the program to Gaza and the West Bank, which is a chronic conflict setting. So just to situate the context, in this region, almost 95% of Palestinian children between the ages of 2 and 14 years of age had experienced punitive violence by a caregiver in the month prior to the survey. Nearly 100% of Gazan parents surveyed reported using physical punishment or verbal punishment with their children. And in Palestine, no laws prohibit corporal punishment of children, and punitive violence is widely accepted. So when we look to transport the program to the occupied Palestinian territories of Gaza and the West Bank, there were a number of considerations and unique contexts that we needed to consider. So looking at the DAP and looking at the various phases, I'm just going to highlight a few of the key sort of findings and experiences that we had. One was that there were multiple stakeholders and multiple organizations that we needed to coordinate with in the West Bank and in Gaza, which made the work incredibly complex. And also challenging was the limited support staff. So as many of us know, NGOs are often working at max capacity. And so in the context of the occupied Palestinian territories, there was limited staff to support the work. And also the clients that were the end users of the program had low levels of education and really were living in deep poverty. So those were challenges that we had to consider. As well, during the preparation phase, we faced significant challenges with the translation. Oftentimes, translation is something that is overlooked. So, for example, the program was translated into Arabic, but the translator didn't have any sort of background in psychology or child development, so really struggled with translating terms like moral internalization, for example, or normalization. And also, there's differences in dialect. So the initial translation of the initial Arabic translation didn't necessarily fit with how the Palestinians would have translated the program, and even the term discipline was very problematic because the term that the professional translator from Lebanon had selected to represent discipline was the same term that the Israeli army uses when describing punishment of Palestinians, which is the exact opposite connotation we are trying to convey with the positive discipline program. So we really did struggle with challenges with the translation. But the interesting thing was we had very minimal contextualization requirements or adaptation. There were very few changes that we actually had to make to the content of the program to make it relevant to the Palestinian context. During the implementation phase, we really struggled with travel restrictions that led to training delays and months of training delays. And we also, I mean, to be expected, I suppose, in a conflict zone, programming was halted due to an uprising and a 51-day war that significantly impacted the implementation. So just to give you a brief overview of the number of partners, both in Gaza and the West Bank and East Jerusalem. So coordinating with all of our partner organizations was a time-consuming process. You're developing relationships with these people, and particularly challenging in Gaza was limited access to electricity. And with there being such a time difference between Winnipeg, where I'm located, and our colleagues in Palestine, and with limited hours of electricity, connecting remotely was very difficult. As I mentioned, it was challenging. We had a lot of restrictions on movement. So many of our trainees were based in the West Bank and in Gaza, but we weren't able to actually host the training in the West Bank because of travel restrictions, so Gazans can't cross the Israeli territory. So what we planned to do was to host a training in Amman, and the Gazans were supposed to cross out of Gaza into Egypt and fly to Jordan, and the Palestinians from the West Bank would cross through that border. And we had planned this training, and it took months of coordination, and the Gazans went to the border to leave. They had their permits, and it was decided for no reason that they were no longer allowed to leave Gaza. And so for us, that meant that we lost half of our trainees, and our training in Jordan was delayed by 2 days. And so what we ended up doing was having a second training where I went into Gaza as opposed to the Gazans being able to come to Jordan for the training. And that had its own challenges. Like I mentioned, the translation was particularly challenging, as were the evaluation measures. So because of the parents' literacy level, we couldn't use a standard evaluation format, so we had to make a very simplified version of the pre and post program questionnaires. So just this is some examples of some of the trainees, both the group that came to Jordan and then the group of trainees from Gaza. All of these people are highly skilled, highly trained. Most of them are pediatricians, social workers, psychologists. So they had a very strong background in child development and experience providing programs to families. And they were very well connected to the families already through their existing practice through their community organizations. And like I mentioned, probably the most significant challenge for us was the conflict operation stronghold, which resulted in significant programming delays and limited staff capacity because many of the staff were diverted to humanitarian relief efforts, as would be expected, but also just the trauma and the impact of the program staff. In this 51-day war, close to 500 children were killed, 1,500 children were without parents, and something like 3,000 people were injured in Gaza. And like I mentioned, another challenge for us was limited electricity, water, and even printing supplies was difficult to come by. So shifting the focus now to some of the preliminary outcomes from the Palestinian context. So even though we faced all of those challenges for the pilot program, we were able to reach 216 parents, and the majority of those parents were actually fathers, which was really interesting. So some speculate that fathers would first come to the program to see if it was acceptable for their wives to participate. You can see that just over 50% had high school or less, and they had many children, so they had large families. And like I mentioned, they completed a simplified low literacy version of the pre and post program questionnaire. So in terms of sort of satisfaction and relevance of the program, you can see that close to 100% of the parents would recommend the program to other parents, and as well they were highly satisfied with the overall program, the program materials, and the program exercises, and there were no gender differences. And as well, when we were looking at our target outcomes, we found significant decrease in support for punishment from pre to post program. We found significant decrease in perceptions of children's typical behavior as intentional misbehavior. So we were shifting those normative beliefs. And as we hoped, we saw a significant increase in that sense of parent self-efficacy from pre-program to post-program. So I'll just show you an example of one of the items that the parents respond to. So the item is spanking is fine as long as the parent's not angry, and you can see there's a 4-point Likert agreement scale. So at pre-test, you can see that the distribution is fairly spread out there. And over 50% of mothers agreed, yes, spanking is fine as long as the parent's not angry. And you can see at post-test, so at 8 weeks post-test, you can see that there's a significant shift in the distribution of level of agreement. And you can see a similar shift of agreement among the fathers. So to conclude from the Palestinian context, we found that the process of transporting the program was very complex, and there were some notable challenges, as I mentioned, translation difficulties, logistics difficulties, and war. But even considering all of that, the parents found the program to be highly relevant in this context, where punitive violence is socially accepted and widely practiced, and where patriarchal values are normative. And we found that the program was effective at reducing parents' approval of punishment, where punitive violence is widespread. Now, of course, these are just parents' attitudes and approval, so we don't know. The limitation of this research is we don't know if that approval then translated into behavior change, but that is an area for future research. So the second context that I wanted to assess the transportability of the program was post-disaster context in Japan. And this is kind of, an interesting context for a number of reasons, but when you look at typical Japanese parenting, there's this idea of children's duty to obey and respect their programs that's really embedded in the culture, and physical punishment is widely practiced and socially accepted in Japan. On March 11th, 2011, the northeastern coast of Japan, which is known as the Sendai region, was hit by something called a mega thrust earthquake, and it's the 4th most powerful earthquake that's ever been recorded. And as a result of this earthquake, it triggered a tsunami, and that tsunami led to destruction of the energy infrastructure in the region. And that led to 2 nuclear meltdowns in Fukushima. I'm sure many of you are familiar with this or remember this. And so in response to this disaster, Save the Children Japan initiated a comprehensive 5-year recovery program. And this included a number of child protection initiatives in the 4th and 5th year of the recovery program. And PDEP was introduced to support families in this region to really help strengthen families by building social supports, increasing parent self-efficacy, and helping to reduce physical punishment of children. And this is important because research shows that implementing parenting supports in the context of natural disasters and other adversities has been shown to be an important component of the recovery process, but very limited research actually has examined implementation of interventions in a disaster context. Japan was also an interesting opportunity for us, given that Tokyo and the greater Tokyo region is one of the most densely populated regions in the world. So this kind of was an interesting example for us to compare the program implementing with parents in the greater Tokyo region and comparing that to parents in the disaster affected region. So I'm just going to briefly touch on some of the key components of transporting the program to these 2 diverse regions of Japan. With Save the Children Japan, they have a very, very strong child protection team. They have highly educated and dedicated child protection advisors who are very well connected and work with the local governments on child protection initiatives. And many of the programs were actually funded through IKEA, so the Swedish furniture company donated a large portion of money to support child protection initiatives in the disaster affected region. During the preparation phase, so I'll just show you, here's an example of some of the work that Save Japan has done in terms of child protection and their Great East Earthquake and Tsunami Response Program, and some of the facilitators that were trained in that region. During the preparation phase, of course, we had to translate all the program materials from English into Japanese. And the translation process, unlike the Arabic translation, was relatively easy and very seamless. And I think that that really has to do with the fact that the person who translated the program had a master's in child development, and she herself was a very experienced child protection advisor. So she really understood which Japanese terms to select that would represent the concept or the construct in English. And anything that was unsure, she was very meticulous in discussing them with us and making sure that the proper term was selected. And interestingly enough, there were no contextual adaptations made from the English version of the program to the Japanese version. I guess the most challenging experience during the preparation phase is just really the 12-hour time difference. So, you know, working in Canada, you're working Western hours, but then you're working with your colleagues in the East well into the evening. So that was a challenge during the preparation phase. During the implementation phase, we conducted 2 program facilitator trainings using simultaneous translation. And the interpreters themselves really studied the material prior to conducting the training. So I feel like that the quality of the simultaneous interpretation was really part of the successful implementation of that training. There were high quality materials, and also we provided weekly mentorship via online meetings to support the new program facilitators during the implementation phase. So just briefly looking at some preliminary outcomes from the Japanese context. So here it was all mothers that participated in the program, and about 60% of those mothers were from the greater Tokyo region and others from the disaster affected region. The majority of mothers were 30 years of older and had a quite a high level of education and had 1 or 2 children. So they completed the standard pre and post program questionnaires. And so here, looking at really the relevance and the satisfaction with the program, here you can see that 90% of the mothers reported that they would recommend the program to other Japanese mothers or other mothers in their community. There were no regional differences, and most of the mothers were mostly or very satisfied with the program and the materials and the exercises. As well as expected and as we hypothesized, we found decreases in support for both physical and non-physical forms of punishment. But interestingly enough, it was actually the mothers from the disaster-affected region that showed significantly greater shifts in their levels of agreement. And the same was found for decreases in perceptions of children's typical behavior as intentional misbehavior. So again, there were significant differences for all mothers from pre to post, but it was the mothers from the disaster-affected region that showed significantly greater shifts. So here's just one example to kind of illustrate that. So it's broken down by mothers from the urban center and mothers from the disaster-affected region. So at pretest, you can see the distribution of the level of agreement, and this is a 6-point scale. And then you can see at post-test for both mothers in both regions, there's a significant skew to the left, and now mothers are more strongly disagreeing that sometimes a spank or a swat is the best way to get a child to listen. We also measured mothers' perceptions of the impact that they felt the program would have on their parents, or their parenting, pardon me, and the overwhelming majority of mothers reported that they felt the program would have a positive impact on their parenting. So you can see here that, you know, high percentages here of mothers felt that the program would help them to understand their children's feelings better, to build a stronger parent-child relationship, help them to control their anger, facilitate stronger communication, understand their children's development, and use less physical punishment. So what can we conclude from the Japanese context? Well, we actually transported it to 2 very diverse Japanese contexts with relative ease. There were limited challenges with contextualization or any culturally specific adaptations, despite traditional parent-child dynamics and favorable attitudes towards punitive parenting in Japan. It was perceived as relevant to mothers, Japanese mothers, raising children in both, a region recovering from an earthquake, a tsunami, and a nuclear disaster, and mothers that weren't directly affected by that, but living in a very densely populated urban region. And the program was associated with attitudinal changes in a society that really has a traditional strong emphasis on children's obedience and compliance and very hierarchical family relationships. And it was interesting because mothers in Japan really do bear the brunt of parenting, and so we were able to show that there were significant changes among mothers where they're the ones who are most likely to use punitive violence. And finally, I'm aware of the time here. We'll just take 5 more minutes here. I just want to share the third and final context in which I transported this program, and this was Cianjur and Bandung Barat in Indonesia. And this region, it's like, you know, characterized by villages. It's underserved, I suppose you could say, and many families live in deep poverty. Indonesia has the highest rate of children living in institutions. Conservative estimates suggest that 500,000 children live in institutions, but those children, 90% of those children do have parents, living parents. Punitive violence is pervasive and normalized by staff and also children in those institutions. And the children that are living in their family homes also experience high rates of punitive violence by their parents. And in Indonesia, there's near universal social acceptance of punitive violence, and there are no laws that prohibit corporal punishment. So just to situate yourself here, so this is a map of Indonesia. Indonesia is south of Thailand and Cambodia, near Malaysia, and it's northwest of Australia. And so the specific region that we were working in is on the West Java province, and in these 2 sort of districts here, Cianjur and West Bandung. So again, using the DAP is a very helpful framework to sort of work through the exploration, preparation, implementation, and sustainment phases. It was really some of the most challenging aspects of the exploration phase were the staffing issues. So initially there was high staff turnover with the partner organizations that we were working with to implement the program, and that ended up delaying the implementation. And also provider and client characteristics were challenging. So the providers, the people that were actually going to be implementing the program directly with parents, actually had very low levels of education themselves. Some of them had like an elementary school level of education, and they're volunteer community health workers working in a very well-developed Cianjur village community health structure. So when I went to begin the process of this particular transportation phase, I went and did a field visit, and that was probably the most beneficial thing that we could have done, because without the field visit, I think we would have made a lot of assumptions that wouldn't have been appropriate for the particular context. So field visits were important. We had to go to the villages. We needed to meet with the village chiefs and also the wife of the village chief, because she is the one who's very powerful in these villages, and she oversees the community health workers. So we spent 2 weeks traveling to these sites, meeting with, you know, the Indonesian government, the sub-district governments, and the village leaders to really hear from them what they were looking for in sort of social supports and family supports. And then also to meet with the community health workers themselves, the volunteers. They're called cadres, and some of them you can see in these images. They're mainly women, just to hear what they were looking for and what kind of education and supports they needed. And what we discovered during this process was that the traditional delivery format and the training model that the positive discipline program is based on was not going to be appropriate for this context. So we had to spend a significant amount of time actually redeveloping the program, so transforming it from a facilitator manual into session plans that were easy to transport for the cadres, so it wasn't heavy. They typically go by motorbike. And we also we discovered that we had to create a hybrid program. So the typical positive discipline program is provided in a group format over approximately 8 weeks, and it's 2 to 3 hours per week where the parents come together and meet. And in Indonesia, we had to create a new an adaptation of the program that's actually a hybrid group program and home visitation program. So in Indonesia, what this looked like was there were actually 10 group sessions where the mothers would come to the ECD center in the village, and she would learn about the program, and then we would do 4 home visits where the father or the mother-in-law, who play a big role in parenting in this Indonesian context, could also be introduced to some of the positive discipline concepts. So this was really a very extensive adaptation specific to the Indonesian context. So these images show sort of the environment, and you can see when it rains, it pours. So the monsoon season makes it very difficult to reach these very isolated and local villages due to mudslides and torrential downpours. So that's something to consider when thinking about implementing a program. And as well, very, very basic centers. There's no PowerPoints or, you know, fancy writing exercises for the parents. Everything was designed to be low or no writing and low literacy. One of the challenges that we faced in Indonesia, and you can see in the photo in the top right-hand corner here, is that there was no childcare. And this made it very challenging for the parents, because when they came to learn about ways to not hit their children, many of the children were present in the sessions, and that made it difficult for the facilitators and also for the parents. So we recommended that any sort of subsequent training or parent programs provide childcare. So taking a look at just briefly some of the outcomes from the Indonesia context, these are not outcomes from the parents. These are actually outcomes from the cadres, or the community health workers. So given their sort of, very basic level of training and low level of education, we felt like we needed to first assess how well the facilitators understood the program materials. And so here you can see that they would highly recommend the training to other cadres. Many were satisfied with the overall training, and they found the training exercises useful. And you can see here that many of them reported at post-training that they felt it increased their confidence. It could be applied to real-life situations in Indonesia. It helped them to explain positive discipline and help them to understand child development, which was a new concept for many of them. We found that in terms of approval of physical punishment, we found that there was a significant decrease in support of physical punishment of the cadres. And this is really important because if they're the ones that are going to be implementing the program with parents, we wanted to ensure that they didn't endorse the idea of, or didn't approve of, physical and emotional punishment themselves. As well, we found a significant decrease in perceptions of children's typical behavior as intentional misbehavior and increases in self-efficacy. And as well, they perceived the program to have an impact, positive impact, on the parents that they would be supporting and also on themselves. Just gonna skip over a few slides here because I'm noticing the time. But what we concluded from the Indonesian context is really it was the first assessment of the process of transporting the facilitator training to this very remote and underserved region. And we found that the training was relevant and useful to cadres that received little or no professional development training and had a basic level of education themselves, and that it was also effective at decreasing support for punishment and for children's perceptions of misbehavior, and it was deemed to be perceived to be effective. So when we look at these three contexts together, we can conclude preliminary evidence suggests that, positive discipline is a promising violence prevention parenting program that is transportable and does have universal appeal in some of the world's most challenging contexts. It was highly relevant to those who participated and was perceived to have positive impacts on caregivers' attitudes and support for physical and humiliating punishment. And this was found really regardless of levels of education, poverty, trauma, literacy, and across gender, language, and faith. So I'm just going to share a few final key lessons. So one is, we must never assume that one intervention strategy or approach, even of the same program, will be suitable for all contexts and clients. Before scaling up, there really is a need to scale out. Investing time and resources into those first two phases is crucial. Accessing organizational capacity is crucial. So are you working with the appropriate staff? Do they have the capacity and interest? And this is really important. Do they have protected time to commit to this work over the long term? And long term meaning years. This can't be done off the side of a desk. And building relationships is really important with stakeholders. And so field work visits are a worthwhile investment. During the planning phase, adaptations and modifications, really you're looking at 3 to 6 months to complete a comprehensive review of the program with local experts and design program adaptations as recommended. Translation takes approximately 2 to 4 months of work, and back translation should be a requirement. And of course, plan for unexpected delays and budget for additional resources. And as I said, childcare is an important component. So a couple of things that we should have looked at more thoroughly is fidelity. You really need to know if you're understanding, you're measuring what you are setting out to evaluate, and not only evaluate parent outcomes, but also facilitator outcomes associated with the training model. And it's really important that we see more evaluation and dissemination of the processes associated with transporting a program because it's that context, mechanism, and outcome that is so important. So I will conclude there, and I apologize for running short on time, but I want to, of course, acknowledge Collaborators, partners, and funding, because this was a real team project over many years. Thank you.
Okay, thank you so much, Ashley, for sharing this information with us today. Let me switch the screen here, and then I will ask a few questions. Okay. All right, great. So we've got a few questions that came in. One attendee was asking about the sustainability of the program, and I'll kind of combine that with another attendee's question. Are these programs continuing to, let's see, are these programs continuing in these to address the ongoing struggles? Oh, I'm sorry, no, that's not the right one. Excuse me just a second. Well, can you speak to the sustainability, or if there will be follow-up in
Yeah,
these regions?
absolutely. Yeah, so the idea when we started this project was that we wanted to build local capacity and we wanted it to be sustainable. So in many, for example, in Japan, while Save the Children Japan really initiated the initial sort of implementation of the program and the training, the model has really expanded. And now a few of the PDEP certified program facilitators and even country trainers have gone on to start their own community-based organizations. So really the idea is that they're working in different regions of Japan and trying to reach as many parents as possible. So the goal from the outset was to promote long-term sustainability. In Palestine, it's been a little bit more challenging, particularly in Gaza. And I think one of the most challenging aspects of it is that there's often a high rate of staff turnover, and it's expected, of course, and it's understandable, but that sort of can set back that building that local capacity and that sustainability. But we are continuing to work in partnership to continue to provide more trainings to expand the pool of people who can then go on and deliver the program to parents directly in their communities through the organizations that they already work with.
Okay, great. Another attendee is asking if you found any significant similarities across the three regions.
That's a really great question. My goal was not, to compare outcomes between the countries, but I have to say, I mean, I absolutely found similarities between parents who are, couldn't be more different from each other or from myself. And particularly one is in terms of the long-term goals for parents. When you ask parents, like, what are your long-term goals for your children? Regardless of where you are in the world, parents say, I want my child to be happy and confident and successful and a good person, and I want to have a good relationship with my child. And that was seen across the countries. And also the reasons why parents use corporal punishment is often the same. It's parents are frustrated, they become overwhelmed, and they fear losing control, and so they use punitive violence, and then they don't feel very good about it. And so parents are motivated to find another way to respond to typical parent-child conflict that you would experience anywhere in the world without punitive violence.
Okay, great. Did you have any information as to kind of pre-disaster versus post-disaster attitudes and behaviors toward punitive violence?
No, we didn't actually. So the program in the Sendai region was implemented in the 4th and 5th years of the recovery program. So the disaster, the recovery process had really started. But actually in 2009, there's a child protection advisor and PDEP program country trainer in Japan, Miss Iko Mori, and she had started sort of implementing sort of orientation sessions to positive discipline in the program in Japan in 2009. So there had been an appetite before then, parents wanting more, but they hadn't really, there wasn't an opportunity at that time to receive the 8-week parent program. And Japan's an interesting country to think about, because now that I think that if they haven't already, they're on the cusp of banning corporal punishment. So I anticipate that there'll be more of an interest in parenting programs that promote nonviolent parenting once the law is passed.
Okay, great. And one attendee was asking about the use of the PDEP program. You may have addressed this, but he's wondering if there had been a systematic review comparing that with other parenting programs, or why that one was chosen specifically?
So, that one was chosen specifically. I work with Dr. Joan Durant from the University of Manitoba, but in my research, I did do a review of many of the parenting programs that exist out there. And if you look at the primary outcomes of the targets of many of those parenting programs, the primary outcome is, or one of the outcomes is to actually increase child compliance. So it's getting children to, say and do, get along with you, say and do what you want. The primary outcome is not to reduce parents' use of punitive violence. So that was one reason. And second is that the PDEP program is really, it's based on these two pillars. One is the research on physical and humiliating punishment. And the second is that human rights imperative, that children have a right not to be hit. And so in my research and in reviewing many other programs out there, like evidence-based parenting programs, there wasn't another program that really uses that rights framework as like the guiding philosophy of the program. So in PDEP, rights and the notion of rights, like not Article 19 says this, but how you can actually actualize children's rights is embedded throughout the program.
Okay, great. Thank you, Ashley. We are at time now, so I think we're going to stop there. Thank you, everyone, for joining us today, and again to Ashley for being with us. I want to let everyone know that a recording of this webinar and a PDF version of the slides will be available within 24 hours on the ISPCAN website. We encourage all of you to become members of ISPCAN so we can continue having informational webinars like these in the future. If you are interested in presenting or have ideas for topics for our webinars, please contact us at resources@ispcan.org. Thank you all again for your time today, and we hope you have a good day or night wherever you are. Thanks so much.
Thank you.
Thank you. Bye-bye.